Dr. Richard Brennan is the WHO's Regional Emergency Director for the Eastern Mediterranean. Sir, as I understand it, power has been cut from incubators and other life-saving machines in the intensive care unit at Al-Shifa Hospital. Babies are being relocated from a nursery. What can you tell us about the current state of affairs? How is the healthcare system holding up?
Well, it's the overall humanitarian situation, I think we could characterize as catastrophic, and in the health system, it's about as bad as in any other sector. Right now, 75% of the 36 hospitals across Gaza are non-functioning. Prior to the conflict, we had about 3,500 beds for patients in hospitals. We only now have about 1,000 beds. And that at a time when health needs are skyrocketing across all of Gaza. In Shifa Hospital, they're really just hanging on. As you rightly said, we estimate 36 newborns still clinging to life, around 27 patients still in intensive care. 4 of them have sadly passed away over the last 2 or 3 days because of dysfunction of some of the life support equipment that would keep them alive. And that's not functioning because of the lack of fuel and electricity and so on. So right across the board, we have soaring health needs, but our ability to meet those needs is really plummeting.
So Al-Shifa doesn't have electricity, doesn't have water, and it has very poor internet, as you've just said, and it's had poor internet for the last few days. Can you just be specific there? How have these outages affected folks? Like, is there associated deaths because of these outages?
Yes, I mean, our information is, we're getting less information now than we were several days ago. I think we can make clear assumptions that people are dying unnecessarily because of the lack of power and the lack of functioning equipment and just the overwhelming need. So, you know, the trauma patients, they're competing for time in the operating room. Doctors have to make some very tough decisions in these contexts. When you've got very limited resources and you've got multiple patients, all with life-threatening problems, you have to make a decision, a very, very difficult decision about, frankly, who will live and who will die. And we hear this continuously from doctors and nurses in Gaza, and we're hearing it increasingly frequently. For example, if you've got 1 or 2 operating rooms and you've got 4 or 5 patients needing surgery at a given time, who do you operate on and who do you delay? If you've only got 1 ventilator functioning and you have 2 or 3 patients requiring it, who do you put on the ventilator and who do you not support? So these are very real challenges that health professionals in Gaza are facing far, far too often.
There have also been some reports that hundreds of people are trapped inside the hospital right now, and the BBC is also unfortunately reporting that there are dead bodies piling up inside as well. What do you know about that?
Yeah, so we understand now there's probably around 600 patients remaining, around 100 staff and upwards of 1,500 people taking shelter there, displaced people. We've all seen the scenes on the television, reports from various news sources about multiple deaths because of the security situation. The hospital staff are not able to take the bodies outside the perimeter of the hospital. So now they are starting to bury in reportedly mass graves on the hospital grounds. And we're also hearing that, frankly, the stench of decaying flesh is permeating throughout the hospital, which makes the overall situation just incredibly difficult for those remaining inside. And you can imagine just the pressure of the doctors on the doctors and nurses, the overwhelming need, the reduced resources, not only the electricity and the water and the oxygen that you've mentioned, but of course, medicine and other supplies. They're really just hanging on by a thread right now and doing a remarkable job, I have to say. I mean, these doctors and nurses, these health professionals, they're heroic and they deserve our respect and our deepest admiration.
Israel alleges that Hamas is using hospitals, including and especially, I guess, Shifa, to conceal a vast command complex underground. They say the sick and the injured are being used as human shields. What do you say to those claims?
Well, all I can tell you is what my colleagues and frankly I've seen over the years. I've visited Shifa Hospital and we have staff on the ground. What I can tell you is that Shifa Hospital continues to provide its medical and life-saving function. None of my colleagues have seen evidence of the militarization of the facility. If that does occur, of course, WHO condemns militarization of any health facility. We haven't observed any of that during the visits of our staff, but we can confirm that it continues to provide its vital medical and life-saving function.
Have you ever seen anything like this, the militarization of hospitals? Like, this seems to be quite extraordinary in terms of the hospitals being at the center of a conflict.
Well, what the allegations are in the instance of Shifa are that the militarization is underground. So, we've heard from multiple witnesses they haven't seen any evidence of militarization within the hospital buildings. I personally have seen in hospitals across many conflict zones and humanitarian crises, I have seen hospitals taken over by military personnel. That is not what people are observing or reporting in the instance of Gaza. The allegations are that the military presence is in bunkers below the ground, not controlling the hospital above the ground so much, but as I understand it. So it's a different context of militarization that we have seen in other contexts.
What can the WHO do? You know, the situation seems incredibly dire, as you've been describing. It's not just Shifa, there are other hospitals that are essentially non-functional. What's the next step? It isn't likely that there will be an abrupt end to this conflict.
No, well, I mean, there's things that we're doing operationally, and there are things that we do on the advocacy side. And of course, our biggest request is that there be an immediate ceasefire. That's absolutely vital. We are also appealing for unhindered humanitarian access to those in need. We're also calling, of course, for the unconditional release of all the hostages and appropriate medical care for them while they are in captivity. And of course, we're asking for cessation of attacks on healthcare and civilian infrastructure. There's been over 130 attacks on healthcare in Gaza. So that's on the advocacy side. On the operational side, we're increasingly constrained in what we can do. Of course, getting supplies and equipment to the hospitals is a top priority. We've made 4 major distributions so far to 7 priority hospitals across Gaza, including 2 in the north, including Shifa. Frankly, we've delivered there twice since the start of the conflict. One of the other big concerns we have is preventing disease outbreaks. With 1.6 million people acutely displaced, 800,000 of them essentially crammed into overcrowded schools and other collective centers where the conditions are woeful, with lack of access to clean water, poor sanitation, overflowing toilets. We're putting in mechanisms as best we can under very difficult circumstances to try and detect disease trends and potential disease outbreaks and put in some public health measures to prevent outbreaks. But it's very, very difficult. We're seeing increased cases of diarrhea and respiratory infections and terrible skin infections like scabies and so on. Of course, what we want to do is support the existing health system as much as we can. We're trying to bring in more capacity. As I mentioned, we've gone from 3,500 beds to 1,000 beds across just at the time when health needs are absolutely skyrocketing. But it's all very challenging because we don't have fuel and we have very constrained access to those in need.
Okay, let's leave it there. Thank you, Dr. Richard Brennan, the WHO's Regional Emergency Director for the Eastern Mediterranean. Appreciate your time, sir. Thank you.
Thank you very much. Thanks a lot.